Living with Diabetes Ask the Expert series. We're so grateful that you're here and joining us today. Today's topic, parents' role in supporting independent diabetes management. My name is Susan Weiner. I'll be your host for this event. I'm a registered dietitian nutritionist and a certified diabetes care and education specialist. And again, so grateful that you're all here today. Our Ask the Expert series is all about you and the questions that you have about this very important topic. Again, parents' role in supporting independent diabetes management. So please start to think about what questions you'd like to get ready so that you will have the opportunity to ask them live to our guest experts during today's event. Stay with us throughout the entire event, and at the end of the event, we're going to have a very brief 6-question survey that'll take you less than 5 minutes to complete. And that survey helps us plan for future events, so we'd really appreciate it. Throughout today's event, we'll be sharing important information, tools, and strategies to help you live your best life on your journey with diabetes. If you're joining today by phone and do have a question that you'd like to ask, please press *3. That's *3 on your keypad, and an operator will collect your question, so you'll have the opportunity to ask it live. You'll be put in a queue. If you'd rather that I ask the question for you, then you can just request that as well. If you are joining us online today, which is also awesome, please type your name and question into the fields below the streaming player, and please remember to hit the Submit Question button. Your question will come directly to us, and I will be able to ask it for you. Caregivers' roles in managing diabetes can change in expected and unexpected ways, creating new challenges as you support your teenager or young adult. Please go to diabetes.org/livingwithdiabetes/youth and family corner for support and information. And as always, if you'd like more information, go to diabetes.org/experts. Diabetes.org has so much great information where you can learn more. So now I'm super excited and delighted to introduce our 2 amazing guest experts that you're going to truly enjoy speaking with today. Dr. Persis, Commissariat, and Dr. Jessie Wong. Persis is a licensed clinical psychologist, diabetes care and education specialist, and clinical researcher at the Joslin Diabetes Center, and an assistant professor of psychology at Harvard Medical School. She provides individual and family therapy to children, teens, and young adults with diabetes at Joslin, and her research focuses on diabetes identity, advanced diabetes technology, qualitative methods, and behavior change in pediatric populations. She serves on leadership teams for the ADA Mental Health Advisory Group and ADA Youth Strategies Committees. Welcome, Persis. We're so excited that you're joining us today.
Thank you, Susan. Happy to be here.
Fabulous. And Dr. Jessie Wong is a licensed psychologist, researcher, and clinical assistant professor in pediatric endocrinology and diabetes at Stanford University School of Medicine. She's the principal investigator of studies funded by NIDDK and ADA that focus on interventions for adolescents living with type 1 diabetes and their parents, as well as applying precision medicine to address risk among people living with type 1 and type 2 diabetes. Dr. Wong is dedicated to advancing the field of diabetes care through innovative research and compassionate clinical practice. Jessie, welcome.
Thank you so much for having me.
So grateful that the 2 of you are here. So thank you both so much for being able to bring so much information to everybody tuning in today about this super important topic. As teens and young adults who are living with diabetes do become more independent, the role of parents and caregivers who are listening today can change in both expected and unexpected ways. And I'd love for both of you to kick off today's discussion by speaking about what are some of the opportunities and the challenges that a parent might expect during this changing time. Persis, let's start with you.
Sure. It's a great question, Susan, and I love to highlight opportunities because typically this transition period, like this transition to independence, happens over an extended period of time. It doesn't happen overnight, which means ideally there will be a variety of opportunities over time to sort of redefine one's role as a parent in supporting their child with diabetes. And the role of a parent was going to change regardless of diabetes, just as a child ages. So, this is in fact the time of life where I think I most often see teenagers just want to do everything independently. They want less parent involvement overall. So, it's not necessarily related to diabetes care, but everything. They just want to be more independent with everything. But diabetes is always there, it's always in the background, and someone has to be responsible for management. So I think the major opportunity here is to really build a strong, collaborative, supportive relationship with your child that benefits diabetes management as they start to become more independent with everything. So, this is really a key time to have those discussions around what do you feel comfortable doing? And how can I help you to do it? And that discussion is obviously it's ongoing because the answer to that question is going to change over time as the child ages, as your circumstances change, or just as you learn like what works and doesn't work for your family. And there's no one way to sort of manage that transition. The plan just sort of has to meet your needs in that moment. So ideally, by having these discussions, by working with your child, by taking their opinion so seriously, ideally what you do here is you decide together how to shift responsibilities for diabetes care, and you build a trusting relationship. You promote healthy communication between the two of you, and you help your child to build the confidence and self-efficacy they need around diabetes management.
It's such an incredible response. And I especially like the way that you started to address it, where everything is changing with a teenager and a young adult who is living with diabetes and everything else in their lives. So
Mhm.
there are opportunities and challenges as well. So thank you so much for that. Jessie, what would you like to add to that?
Yeah, so as far as on the challenges side, like any transition, there can be a lot of uncertainty that comes with the transition towards independence. And that uncertainty can be challenging for a lot of us. So there might be uncertainty around what the adolescent or young adult wants to take on, what they're able to take on. And then both parents and youth can be uncertain about how parents can be supportive because what their needs are constantly changing. So the way that you might have been supportive before or encouraging them might be different now than it could have been in the past. Also, I think it's really important to acknowledge that parents sometimes put a lot of pressure on themselves to help their child become independent because they want to feel assured about their child's health and safety in the future and know that their child's going to be okay. But putting too much pressure on ourselves ends up putting pressure on your child. And also, that can lead to stress, frustration, and disappointment for you and also for them. You know, a lot of adolescents and young adults feel a lot of that stress and frustration and pressure because and that can lead them to worry that if they're struggling at all with any parts of diabetes that they might think, oh no, this is a sign that I'm failing, when in reality diabetes management is incredibly challenging. Everyone's going to struggle here and there, and that shouldn't be perceived as a sign of failure or lack of independence. I think for a lot of parents that I work with, there's this feeling of stress around letting go. Like that is a major
Mhm.
barrier in this transition because what parents, especially who have been very hands on and very involved in diabetes, the idea of stepping back and letting someone else figure out their own way and let them make mistakes and learn from them can be very, very challenging. So, as a parent, I think one of the things to think about is how am I going to get through this process of letting go? And then there's also challenges that, you know, like Persis mentioned, that are developmentally appropriate, but create these bits of barriers. Like there's more physical distance between parents and kids during this stage of life. And also, parents just can't supervise as much as they did because of both the distance and because the adolescent is being independent in a lot of different life domains. And that can make it harder to communicate and provide support. But I really encourage all of you to recognize that all of these challenges are best faced when they're viewed as opportunities, just like Persis mentioned. And if you can navigate and overcome these challenges together with your child, then you both get to come out the other side stronger.
That was so amazing that you brought up not just the distance physically, but there is going to be more of a physical distance as a child is becoming a teenager and a young adult. And we don't think about that as part of all these changes and opportunities and challenges and letting go. There's just so much going on here. So thank you for bringing that up. And looking at the positive and looking at the opportunities is so important. And active listening, which I know we're going to talk about more today as well. Thank you both. If you're just joining us, welcome to today's Ask the Expert event, Parents' Role in Supporting Independent Diabetes Management. And as a reminder, because we know that you all have a lot of questions that you'd like to ask, for those of you who are joining by phone, please press *3, that's *3 on your keypad, and an operator will collect your question, place you in a queue, so you'll have the opportunity to ask it live, or I can ask it for you. And if you're participating online, please type your name and your question into the fields below the streaming player, and please remember to hit the Submit Question button so we can focus on today's topic, which is, again, parents' role in supporting independent diabetes management. We have one question that's coming in online that we'll start with. And Persis, this one, if you wouldn't mind taking it first. How do I know when my child's ready to handle more diabetes-related responsibilities without me having to remind them all the time? I'm so used to reminding them of what they need to do in regard to so many different things, but in particular, helping to manage their diabetes.
That's a great question. And I feel like you're going to laugh, but the most simple answer is you ask them, right? You ask them whether or not they're ready to take something on. Because if your question is, how do I know if my child is ready? I don't think it's something that can be decided alone. I often tell parents that during this time, they're still children, right? Teenagers are still children. They're going to make mistakes. They're navigating a whole bunch of different stressors in their life, and taking a more collaborative approach of asking, what do you want to take over? What are you willing to take over? What would be easy for you to take over? Can really shed a lot of light and insight for the child into what they are able to do in this transition process. So coming up with that together of what responsibilities your child might be able to take on versus what you will continue to do has to come from each of you. And then I always encourage families, just try it and see how it goes. Because in this moment, you've decided on something that you are both willing and able to do, which means there's potential that it's more likely to happen because that decision was come to as a team. So if you are able to try it, see how it works, and if it doesn't work, then you problem solve. You figure out what worked and didn't work in this plan, and what could we do differently to help us along this pathway to independence. I think one really important thing to remember, though, in thinking about whether a child is ready is that, as I said, they're still children. I feel like this is something parents often forget, that no matter how long your child has had diabetes, they still develop like any other child would. And so when all of these new responsibilities come up, the stress of school, being social, playing sports, they're still trying to figure out how to handle all of that, just like any of their peers without diabetes. So it's very important to just keep that in mind, that the transition may not be perfect. It will take some trial and error, but I think developing that discussion more, like really going through what your child is able to do, showing them that respect, that this is your diabetes, and I trust that you know your body and you know your capabilities, is really key in this. I'm a big advocate for ensuring that people with diabetes get a say in all of this, because it's their treatment, it's their plan, it's their diabetes and their management going forward. And I hope that as parents, we can also model that for them, that collaboration and that shared decision making.
And in that shared decision making and figuring that out, and of course, the greatest advice that you gave, asking them to figure that time out. What are the circumstances to bring that up? So I think a lot of times there's just a heightened conversation because something may have gone wrong or not been on track. So can you speak about how to do this in a calm way, or maybe in a way that will foster a discussion rather than an argument? To put, I don't know exactly how to put that, but to keep it on a calm level to foster a positive discussion around this topic.
Yeah. Well, I think you're right, Susan, that there are often times where this comes out of a negative situation. Ideally, we would take that negative situation and you still have to make a plan around it because you don't want the same thing to happen again. But ideally, what we could do is start to have that discussion early, like in the same way that we do, annual visits at a doctor's office, like maybe having this discussion as your child ages of what's going well and what's not going so well, and what can we do differently, and how can I help you differently? Because we know that everyone's role is going to change as the child ages. So having those more repeated, consistent check-ins can be really helpful to see, when a child is feeling more ready to take things
Mhm.
on. Similarly, it can be really helpful to focus this discussion around maybe a positive upcoming event. So, for example, we talk about this a lot when kids start thinking about going off to college. That's the time when we know they're going to be primarily independent. Many of them do move out of their parents' home. So, the discussion then becomes more thinking about, okay, how do we make college as great as possible? How do we do this so that you can go off to college and still be safe and I won't worry about you while you're there? So they have something to work towards. Similarly, for your younger teenagers who are just approaching that like preteen teen stage where they want to have a little bit more distance, maybe this discussion starts around sleepovers or going out with friends without a parent supervisor, or sports, for example, like a concentrated period of time where I need you to pay attention to diabetes, and I can be there for support, but you are the primary. So these are all opportunities to have that discussion without having to wait for something to go wrong, because ideally the transition to independence with diabetes management does come over time and does happen in sort of a focused way. I suppose that's the
Yes.
best way to put
Yes,
it.
that is. That's a great way to put it. Thank you so much for that. We have a bunch of questions coming in online. So the first one's coming from Chris. Second question's coming from Chris, actually. So Jessie, if you can start by answering this one. How is it best to support the soon to be 21-year-old T1D, person with type 1 diabetes, who wants to enjoy alcohol?
Yeah, that's a really great question. Every clinic is different, but I am very fortunate enough to work in a clinic where part of the education and training is to cover topics like that, risky behaviors that we're not trying to promote, but that we want people to be able to do safely, knowing that some of the experimentation and exposure is expected part of development, right? And so I think the best approach as a parent to take is something that we call harm reduction, not trying to say, oh, this is all evil, stay away from it at all costs, or I'm going to judge you, because that closes the door on communication. And it also puts kids at risk, because if they find themselves in a tricky situation, they're not going to want to open up to you or try and get any support from you in those situations. They'll do whatever they can to. Very, very dangerous when we're talking about diabetes and alcohol. Having open conversations, discussing, making sure that they have education around the effects of alcohol and sometimes other substances on blood sugars, what to expect, what to make sure that they can do to keep themselves safe. And then also making sure that you try and have as open communication as possible, letting them know, hey, if all else fails or no matter what happens, you can always contact me. The other thing too that can be really helpful is, even though physical distance is common to grow during this period, we live in an age where we have a lot of technology. So following blood sugars is a thing that parents can do that can provide some reassurance and a safety net and safety plan. But also location sharing can be a really important thing as well.
Yes.
If you can't reach your child. And then also similarly, when we're talking about 21 and around that age, making sure that they have someone, a close friend who tends to be with them in those situations, that not only understands type 1 diabetes and would be able to respond appropriately in an emergency, but that you might also have the contact information for that person and the understanding that you would only reach out in certain situations.
Excellent. Thank you so much. And these are such great concern questions coming in, and your responses are phenomenal. Thank you both so much. Annette is writing in with another outstanding question for either one of you who want to answer, or both. When are appropriate times to join medical appointments, if ever, once you have a teenager or a young adult with diabetes?
So this may be clinic specific. I know in our clinic, we do tend to have some private time for a teenager, and for young adults, they are by default the patient, right? So you don't necessarily bring in a parent unless the young adult wants to bring in a parent. I think for teenagers, you may want to talk to your teenager about this and talk to their medical team about it to see what the best approach might be. But regardless, to always honor the opportunity to give them some alone time, because as teenagers age, they want that independence and they're entitled to their privacy. And I'm sure in any clinic, if something dangerous or concerning comes up, that the medical team would share that with you.
And just to
Yeah.
add on to that, oh, sorry, go
No,
ahead,
please
Susan.
continue, Jessie. I was just going to say yes, please go ahead.
Okay. Just to add on to that, yeah, I don't think that there's specific ages. It just really depends on the individual and the family. And like Persis was saying, I think it's important to establish boundaries and give them some privacy and some space to explore their relationship with their provider and how they manage their care. But then the other piece too is a lot of the adolescents I work with don't want to hear the parents' questions and comments that they want to have with the endocrinologist. So in some ways, it also is protecting them a little bit from you doing what you feel like is necessary to as a parent, but that they might not need to hear and they might feel burdened or stressed by as well. So I think exploring all the different configurations and having open conversations about when it's appropriate and in what way should it be done is a really good thing.
Outstanding. And as we're talking about the parents' role in supporting independent diabetes management, if you have a question that you'd like to ask by phone, please press *3 on your keypad and we will collect your question and you'll be able to ask it live. And we're getting a lot of questions that are coming in online or questions that you want me to ask. So if you're asking a question online, you can type it in the field below the streaming player, hit the submit question button, and we will be glad to address it and ask it for you. Marie is writing an online question, which is another great one. And we're actually getting a few of them that are similar to Marie's question. Teenagers are frequently somewhat defiant in that they don't want parental involvement. So how do you deal with a teenager when they say something like, just leave me alone, I can do it? And if they are referring to doing it and they don't actually do it, I want to do the right thing as a parent. Persis, we could start with you. How would you answer Marie about that, about the teenagers being very defiant and leave me alone?
You're right, Marie.
Yeah.
You're right. It happens, right? It happens a lot. I think that it's a very person-specific situation as to why your teenager might be reacting in that way. And oftentimes when this comes up, and I know I've had situations where I've asked a teenager, well, what happened if you said you were going to do it and then you didn't do it? Sometimes it becomes a little easier for them to share their reasoning with me than share it with their parents. And that is simply because I'm the outside third party, right? Like I have limited investment compared to a mom or a dad. So I think having the conversation around this can be really challenging. And sometimes it can help to take a bit of a different approach to the conversation. So removing the question of, you didn't do it, why didn't you do it? And instead saying, it seems like it was tough for you to get this done. So next time, what should we do? Like, should I just, take over the bolusing? Do you want me to stand here next to you? Like, we have to do something different because every time I remind you to do something, you tell me you can do it and then it doesn't happen. So I just want you to be safe. Tell me how we can go about this differently. I think oftentimes it's a big question for a teenager. They may not answer you right away. Some of them will take some time to process it, even if they are defiant and angry in that moment. But I do recommend approaching that conversation from the standpoint of like, what can we do differently as opposed to why didn't you do something? Now, that's not to say that's what you're doing, Marie. I don't know if like what the discussion is with your teenager, but I think that it's just really valuable to find out what their barriers are. Similarly, and maybe Jessie can comment on this a little bit more, I think that maybe having this discussion even in a medical visit, if you have a behavioral health provider on your team, someone like that who can ask the question and really break this down a little further. Is your teenager stressed by the reminder of doing diabetes care? Are they frustrated by diabetes itself? Are they, angry at you because you're constantly reminding them to do things that they don't want to do? Or is it just sometimes this is challenging and they're a little forgetful and they don't want to be distracted and they're doing other things? Like there's so many things on a teenager's mind. So figuring out where some of that defiance is coming from will be really helpful in figuring out your next steps.
Fabulous.
Jessie, do you want
Jessie,
to?
Yeah, I was just going to add in that most of the time when I talk to adolescents about reminders from their parents, the response is sometimes they're helpful, sometimes they're not, but I have the same rude response to them every time, no matter what. And like we were saying, this is developmentally appropriate, like not just with diabetes, but trying to get space and assert your, competency and independence. And what I recommend is figuring out how do I give them enough space so they can figure out their own way. And then also having a conversation with them if they're really reluctant to have you involved, or if they don't want any reminders, then to say, here, why don't we try it out your way, but can we have a plan? What would be some signs that whatever we're doing isn't working? Like, here are the signs right now that what we're doing isn't working. What would be the signs of what we're going to try next isn't working? And once we see those signs, can we have another conversation then? Don't assign a threat to it. Say, oh, if you don't do this by the end of the week, then I'm taking over. I'm going to remind you 50 million times. No, it's just, would it be fair if we had another conversation if that sign comes up? That way you have a clear understanding. It won't be caught off guard. And you're kind of changing that push-pull dynamic into more of a collaborative one.
And it is a push-pull dynamic. That's a great phrase to describe it and to encapsulate those discussions. Absolutely. Absolutely. We have another question coming in from Ashley, a statement and a question. And Ashley says, my child was just diagnosed with T1D, is transitioning in life really well. If and when he starts to get burnt out, what are some of the ways that I can support him to be resilient and press forward with strength? Beautifully said, Ashley, also. Jessie, why don't you start with that one?
Yeah, love the question, and congratulations on the transition going smoothly. It seems like you're all in a great spot, and thinking ahead to burnout is fantastic. One of the things I like to focus on is just because someone can do something doesn't mean that they should. And I think that's where people get caught up a lot of times with diabetes of, well, I've seen you change your pump, so you should be able to do that. Or adolescents putting that pressure on themselves. But there's a lot of things that all of us can do as humans. That doesn't mean we should be doing them all of the time, nor would we be able to function. So I think having conversations about, well, what can I help with? What would feel comfortable to you? And sometimes it's small things like setting up the pump supplies, or sometimes if someone's had high blood sugars all day that have been stressful, maybe taking the chores off their plate. It doesn't have to always be diabetes related to help prevent diabetes burnout. And I think it's good to just have open conversations about, I want to support you in a way that feels good to you. And just remind yourself that you only have so many years that they're going to be home with you where you'll be in this position to support them. So really getting creative and trying to think from their perspective about what will be instrumental in that. And then the last tip is something that we call a diabetes vacation, where for some people, the main burden of diabetes is just having to have it in the back of your mind all the time. So it can be helpful to carve out a few hours a day or a day out of the week where you say, hey, I'm going to be your pancreas. I'm going to manage diabetes. You don't have to think about anything. If something needs to be done, I'll do it. And that's something that if you can build into your routine can be really helpful in preventing burnout later on.
It's great advice. That's wonderful. And I think that that's a term that many people may not have heard before. So thank you for sharing that. And Persis, I would ask, is there anything that you'd like to add? That was amazing, Jessie. Thank you so much.
I agree. I fully agree with everything Jessie said. I find that diabetes vacations can actually be really valuable to people, even if this isn't a moment right now where your child necessarily needs one. It can also just be helpful to bring up, to say, should this ever come up and you need my help, I'm here. Like, just really cementing yourself as someone who can take over parts of diabetes care. I find that there are times when teenagers, as they become more independent, feel that they know more than their parents. In some cases, they do. They're the ones who are changing the sites every 3 days and swapping out CGMs every 10 days. Like they tend to know their bodies a little bit better than when they were children. And with that, they sometimes feel that their parents can't take over their care. So I think remaining involved, remaining interested and invested, asking questions, not just when things go wrong, but when things are going well, and can you teach me what you're doing, can really cement that trust for when you may need to take over later on.
Such fantastic and really useful and really helpful tips, very practical, that you both are describing today, and very appreciated by a lot of the comments that I'm seeing. So again, very grateful to have this discussion. Jessie, we have a question that's coming in from Patty, who asks, what is a simple and clear way to hand over more diabetes tasks gradually to my teenager or young adult?
Yeah, so I like to just keep things as simple as possible. So first of all, ask. Like Persis said, this should all start with discussions of like, well, what's something you would want to learn about or want to take on? Or another way of framing it is, what would you like me to nag you less about? And then find a task you both agree upon, then show them. And a good way of showing them is just do what you know to do and just narrate out loud everything you're doing and every thought you're thinking while you do it. And then you can do that until you feel comfortable. And then the next stage is to do it together, where you do one step, they do one step, or you take turns. And then once that feels comfortable, the next step is they do it and you're there as backup to support or to jump in if needed. And then you transition to the last phase, which is just observing and backing off and letting them do it their way and keeping your opinions to yourself. And how long you stay in each of those stages is 100% determinant on you and your child and how you both feel like things are going. But it's nice to have it doing this gradual approach, including tasks that might seem complicated or far off in the distance, because oftentimes it's the unfamiliarity with them that makes them daunting. But just starting with the showing, and maybe that's, you show a task and that's not a task that they even start to actively take on for a couple of years, but then at least they've dipped their toe in the pond.
Patty actually asked as you were answering that, Patty asked a follow-up question to that, which is there any kind of support groups or a place where caregivers and parents, guardians of children with type 1 diabetes can have peer support around all of this?
I'm happy to share some unless you want to jump in, Persis.
No, go ahead.
Great. So, my understanding is through ADA, there are various support groups and both local chapters and online forums. There's also some really wonderful organizations like Breakthrough T1D and an organization called Children with Diabetes. And in a lot of them, if you go, there's in-person gatherings, there's online presence. I've heard from a lot of parents, there's some great Facebook pages and groups online. So yeah, there's a lot of opportunities for support. And I really do encourage parents to seek that support because it's a very unique position that you're in. This is a very distinct dimension of parenting during this developmental stage that a lot of other parents aren't familiar with. So it's nice to have that support and camaraderie when you can find it.
Those are fabulous groups. Persis, did you have more that you wanted to add?
No, I think the major organizations are probably the best place to start. So places like ADA, Breakthrough T1D, Children with Diabetes are the biggest ones that I know of. You may also find if just, with a quick Google search, there are oftentimes local support groups depending on the area that you're in. I'm in Boston, and I know that in Boston we do have local support groups just started by parents of children with diabetes who
Yes.
meet up and have discussions. So you may be able to find those just by searching your area.
Absolutely. Those are all great suggestions and fantastic organizations as well. Our next question coming in, Jessie, we can start with you on this one. At what age should someone be fully independent?
Well, I think that's a tough question to answer because what anyone's definition of fully independent is can be very subjective. And I think it's important to note, based on everything Persis and I have said, is there's no magic age. And also, age is not nearly as important as maturity and development and what someone's expressing interest in. So I always like to say to focus on the process of moving towards independence and not focusing on an outcome. And as long as you're taking steps and your adolescent and young adult is taking steps in that direction, don't worry about how long it's taking. I feel confident that you'll get there. And I think, if there's safety concerns, then it's good to kind of reevaluate what you might be working on and what the next steps might be. But yeah, there is no perfect cutoff. And I think it's a big balance of just people figuring out too, that even as an adult and being independent, what support they want to have in their lives from the people around them who care.
Keep on keeping the conversations open. That's for sure. And to get through a bunch of these questions, Persis, I'm going to move on to this one. And this is so important. And I hear this question a lot in my practice throughout the years as well. How can I keep my child, in this case, John is asking about his daughter safe at night when she's away at college?
That's a great question. Well, I think it's sort of similar to even the drinking question that was asked earlier, in that it's really important to create a plan. So plans need to be when away at college, both how to stay in range overnight and then what to do if your child's blood glucose goes out of range. So in a plan, I often tell people the things you need to think about are what your child is going to be doing independently to prevent these, glucose excursions. And then importantly, agreeing upon how you are going to communicate with each other, because a parent who may be perhaps, following a CGM from afar could see numbers dropping, get really nervous, start calling over and over. The child may not hear it. The child may be out somewhere. There's a variety of reasons why someone may not answer your phone call. And with that, it is really important that everyone knows what the expectations are while a child is away at college. Nighttime, I realize, is especially scary for parents. So agreeing upon, what the child is going to be doing while they're away at college, how they're going to communicate with their parent at any given time, whether it's, regularly or only when the beeping starts, knowing who is going to follow their data. perhaps in addition to parents, they may want a friend on campus, a roommate, an RA, somebody who can also follow CGM data if that child is on CGM, figuring out how are you going to reach out to your child? Are they going to answer a phone call? If they don't answer phone calls, who do you call next? And is there perhaps like a priority list? Do we text first, then do we call? If they don't answer, do we call an RA? Do we call campus security? Like figuring out those step by steps is really useful for both of you, because then you also don't catch your child by surprise while they're away at college and suddenly they're, sitting on their bed treating a low and campus security shows up at their door. So knowing the expectations for both parent and child are really important. So you'll have to consider what each of you can do and the other contacts that you can get involved while away at college. And of course, as I said before, all of these plans should be reviewed and revised as needed. You may find that we agreed on texting and your daughter never responds to your text messages. So perhaps we need to come up with a new plan for how we are going to communicate. Is it what you're saying in the message? Is it when you're sending it? Is it just that she doesn't look at her phone and so we need a different way to reach her? So these are all things that need to be just really iteratively revised over time, just to make sure the plan best fits your needs in any moment.
Updating, and just as when a child is younger and there might be a babysitter who might have to first be educated on type 1 diabetes, excuse me, and you have that care plan and that exact plan of who to call and what to do next, these plans have to be continuously updated and revised. That's fantastic advice. Jessie, please address this one, which is also coming in from a Jess. We have a lot of Jessicas writing in today. This is fun. And Jess writes in, my child is no longer a child, but a young adult and a new mother. How can I support her during this life change?
Oh, that is so congratulations. And that's such a wonderful question to ask and wonderful thought for you to have in your mind. I think this goes back to what Persis was sharing in the beginning, and she put so beautifully, which is ask and have a conversation, and if your daughter doesn't know and she's kind of overwhelmed and uncertain, then kind of rely on what you know about her and the situation to see, okay, well, maybe it's bringing over food and it's not diabetes related, or maybe it's keeping track of her diabetes supplies and helping with that. Trying to figure out and then offering those things and trying to be proactive can be really helpful. But I think the main thing is to ask, and then to also let her know that your intentions and that you see her and that you want to be there for her and support her. I think that's one of the best things a parent can do at any stage.
There's a beautiful answer. And Jess, congratulations on your child as a young mother and supporting her. That's all very beautiful. Persis, I'm just running through these a little quick because we have so many coming in. Persis,
Sure.
this one's a great question too. As a parent of a now 8-year-old T1D, do you think diabetes camps are a good place to start for independence? I'm so nervous sending her, as I've heard she will have to manage her own alarms and her care.
I think diabetes camps are amazing. I truly do. While it's true that, you're not going to be there and your child is going to have to manage differently, they're well supported at many diabetes camps. I obviously can't speak to every single one, but some of the major camps out there, ADA has a camp, the Barton Center has a camp. All of these camps tend to have providers on staff who are medical providers, will be able to help as needed. But I do think there's a lot of value in the peer support that's coming in. So I know the question is about independence and whether they're good for independence. And they may be, like for many children, they are, because your child is learning new things and they're seeing how other people manage and they're growing confident in themselves and what they can do. But in addition to that, I think the major benefit of diabetes camp is, feeling comfortable with diabetes, feeling comfortable doing the tasks, asking questions, talking about it with other people, and still being supported, still having a team around you who is able to help as needed when your parent is not there.
And with being with people maybe for the first time as a child who are living with type 1 diabetes, just as they are. And also the counselors and many people at the camp are obviously living with type 1 diabetes. And I would add to that as well, if it's an 8-year-old and you're thinking about it, you can speak to the camp if they think that that might be a little young, or if that's the age group that they work with. Jessie, did you want to add anything to that?
Yeah, I was going to say also they have family camps that I think are a great opportunity too to go with kids. And yeah, and like Persis said, I think it's just an amazing opportunity. There are medical professionals on site. If they are allowing kids that age to go, they have vast experience with it. And it's great because there will be kids there who are more and less independent than your child, and it will kind of put things into perspective for you and for them. So I think that they're one of the most valuable resources out there.
Outstanding. There's just so much to discuss on this topic. We can have this conversation all the time, all day, and so many people are interested. It's just such an important discussion. So remember to discuss any therapeutic, mental health, or other concerns that you or your child may have collaboratively with their healthcare team. Join the peer support groups online or in person, and talk openly about diabetes care and changing roles with your child, your young adult, your teenager, and with their physician and their healthcare teams. Remember to go to Youth and Family Corner at diabetes.org and to register for our next Ask the Expert events at diabetes.org/experts. And also, I can't thank you both enough, both Jessie and Persis, for your amazing information today. And Jessie, let's start with you. Are there any points that you wanted to make sure that our listeners take home from today's discussion, or anything that we didn't talk about that you want to make sure to share?
I just wanted to reemphasize the importance of open communication and fostering conversations about diabetes management, and how both of you can promote your child's autonomy while also providing them support, because this helps build confidence and it prepares them for independence. And then lastly, I just want to say, I think it's really important to celebrate progress while you're managing challenges, because building independence is a gradual process that includes both successes and setbacks. So celebrating small victories and viewing challenges as learning opportunities really gives you a chance to show your child that they're not alone in their journey and that you're there with them too.
Amazing, amazing. I would ask one more point on that before I ask Persis for her closing remarks. Some of the questions that that are coming in today that we didn't get to are from parents who are living with type 1 diabetes, who have children with type 1 diabetes. And they were just saying in some of their comments that they're trying not to put a lot of the burden or the guilt that they may feel on having a child with type 1 diabetes when they are living with type 1 diabetes. Can you make a quick comment about that?
Yeah, absolutely. I think as a parent, it's really important to take some time and space to process feelings of guilt that you might have around your child's diabetes diagnosis, whether that's with a therapist or a friend or just on your own, because parenting from a place of guilt is usually not the most effective or helpful parenting. And even though on some ways, there's a genetic component, most guilt isn't actually rational. It's just kind of a knee-jerk reaction. So giving yourself some self-compassion around that. And then also knowing, if anything, you sharing this diagnosis will give you that much more empathy with them. And so I think trying to not have your guilt or your experiences with diabetes be placed on them, but trying to come to a place of, I know how hard this is and can be, and I want to support my child in a way that they feel the most supported.
Thank you so much for that. Persis, would you like to also make some closing comments and some takeaways from today's discussion?
Sure. I think similar to what Jessie was saying, I think the most important thing for me is that open communication. And in fact, similar to the last question that was asked, I also live with type 1 diabetes. I have for 25 years. And so it perhaps comes from my own experience that I say, I think it's so important for people with diabetes, regardless of their age, whether they're 5 years old or 25 years old or older than that, that you take their opinions into account. I think that can be really challenging in that pediatric stage because oftentimes children are not making the best decisions. They don't have the best judgment, and they also don't handle everything on their own. But keeping them involved and talking things through, taking their opinions seriously, I think can be so valuable, not only to your relationship, but to help them build confidence. Because so much of diabetes care is building self efficacy and knowing what you're capable of doing and how you can do it and how you can fit it into your life. So, making sure that you involve your child to the extent that they feel comfortable being involved, I really think pays off in the long run.
Thank you for that. And thank you for sharing your personal story as well. I think it's very meaningful to everyone who is listening today and all of our attendees. You both were fantastic experts on today's program, and I hope that you'll be able to join us for a future event because we've gotten so much interest and so many questions around this topic. It's been extremely helpful. Thank you both so much. Thriving with diabetes takes a team, and we're here to support you. A special thanks to both of our guest experts today. My name is Susan Weiner, and again, on behalf of our guest experts today and the ADA team, we want to thank you for joining us today, and we look forward to connecting with you on our next event. I also want to point out, as we were talking about today, diabetes camps, registrations for our 2026 camp seasons opens actually tomorrow, which is Wednesday, February 11th at 12 p.m. Eastern Time. And you can learn more about this, which I know is valuable information to many people listening today, at diabetes.org/camp. And as I always say, go to the diabetes.org website and just tool around and explore. Great amount of information. But tomorrow does open up the camp registration. So diabetes.org/camp, explore there and see what, if that is something that may work for your family or your child. Your feedback is super important to us. Just to reiterate, in a few minutes, we're going to have our poll, our very quick survey. So stay tuned just for a few more minutes. Please join our next Ask the Experts event on March 10th at 2 p.m. Eastern Time, navigating your options, medical treatments for overweight and obesity. And on April 14th at 2 p.m. Eastern Time, be ready, stay safe, what to know about severe hypoglycemia. We have amazing guest experts for those events as well. You can register for these events at diabetes.org/experts. And if you also check on there, I know we had a couple of questions coming in today to see, there was so much great information today to see if it's recorded. Yes, it will be. Check back in a few days at that diabetes.org/experts, and you will be able to see the information from today's program and event recorded. If you have any additional questions about this event, please email askada@diabetes.org. Include Ask the Experts Q&A in your subject line. And thank you so much for joining today. And now let's begin our survey. We'll jump right in. Again, this will be less than 5 minutes. It's a 6-question survey. I want to thank you again for participating in our American Diabetes Association's Ask the Expert event. And let's go to our first question. Question 1. This event met my expectations today. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Question 1. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. If you'd like to learn more about treatment technology and tools at the ADA's new consumer guide, check it out. There you'll be able to utilize a comparative tool to find the right products for your diabetes care journey, for your family's diabetes care journey as well. So that's the new consumer guide that's available on the ADA site. Okay, let's go to question 2. I will attend another Ask the Expert event. Question 2. I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, press 3. I will attend another Ask the Expert event. For yes, press 1. For no, press 2. And if you're unsure, press 3. Whether you are living with diabetes or have a loved one who is, building connections with other people can be the best medicine. Chances are there's some great stuff happening right now in your own community, from fundraisers and drives to summer camps and more. Please check out diabetes.org/tools resources to get connected with more information. That's diabetes.org/tools resources to get connected for more information. Question 3. This event improved my knowledge of a parent's role in supporting independent diabetes management. Question 3. This event improved my knowledge of a parent's role in supporting independent diabetes management. For yes, press 1. For no, press 2. And if you're unsure, press 3. This event improved my knowledge of a parent's role in supporting independent diabetes management. For yes, press 1. For no, press 2. And if you're unsure, press 3. If you are a parent or a caregiver for a teenager or a young adult and want to learn more about driving with diabetes, visit the ADA's information on driver's license at diabetes.org/tools and resources, driver's license information. And there's some great information that I know everybody who has a teenager who wants to drive might be interested in at that site. Question 4. I intend to use my knowledge that I gained for myself or my loved one's next appointment with a healthcare professional. I intend to use the knowledge I gained in myself or my loved one's next appointment with a healthcare professional. For yes, press 1. For no, press 2. And if you're unsure, press 3. I intend to use the knowledge I gained from my or my loved one's next appointment with a healthcare professional. For yes, press 1. For no, press 2. And if you're unsure, press 3. I always want to give a shout out to the Food Hub on diabetes.org if you want more information about recipes or nutrition. So that's Diabetes Food Hub, HUB, foodhub.org. There's some excellent information there as well. 2 more questions to go. Question 5. Before this event, I felt confident in my understanding of how a parent or caregiver can support independent diabetes management for a teenager or young adult. For yes, press 1. For no, press 2. If you're unsure, press 3. Before this event, I felt confident in my understanding of how a parent or caregiver can support independent diabetes management for a teenager or young adult. For yes, press 1. For no, press 2. And if you're unsure, press 3. Remember, the registrations for the 2026 camp sessions are open tomorrow on Wednesday, February 11th at 12 p.m. To learn more, go to diabetes.org/camp. That's diabetes.org/camp. And our final question. After this event, I have an improved understanding of how to support independent diabetes management for a teenager or young adult. For yes, press 1. For no, press 2. And if you're unsure, press 3. After this event, I have an improved understanding of how to support independent diabetes management for a teenager or young adult. Press 1 for yes, 2 for no, and 3 if you're unsure. We sincerely appreciate your time and look forward to engaging with you on our next event. Thank you so much for joining. My name is Susan Weiner, and we appreciate your time today. Thank you and have a great day.